And I was shocked to hear this. 3-4 weeks ago, I said, well, how many people die a year from the flu? And in this country, I think last year was 36 or 37,000 people. And I'm saying, wow, nobody knew that information.
President Trump met with top pharmaceutical company representatives at the White House yesterday, where they kept explaining to him why it's going to take some time to develop a vaccine for the coronavirus.
When do you think you could have the vaccine? When do you think you'd be able to have it, start producing it?
We're producing it now, an experimental lot. Proteins take somewhat longer than some of the other technologies, more exploratory, but it's a technology that works. We think we can be ready for the clinic in a year. And depending upon the nature of how the epidemic goes or doesn't go, we would, and with the help of the agencies of this country, perhaps as few as several years.
We have 1,000 antibodies that are already sitting in dishes. We're screening them. We're selecting them. We anticipate, if all goes well, 200,000 doses per month can come out of our factory in New York starting in August. The unique thing about our technology...
That means you'd be able to use the vaccine that early?
Depends on what we see, how we work closely with the FDA, which we will do. The FDA has already reached out to us, but we've got to work closely.
So that process would be faster than John's?
It would be.
We're now working on the phase 2 material. So that as soon as we get the phase 1 dose out of the NIH, we'll be able to start the phase 2 right away.
What is your timing then? What would you say?
So we're hoping to get the phase 1 start very soon now. We're just waiting for a green light. The product is at the NIH. And then it's going to be a few months to get the human data that will allow us to pick a therapeutic dose to start the phase 2 right away.
So you're talking over the next few months, you think you could have a vaccine?
Correct. With phase 2.
Yeah.
You won't have a vaccine. You'll have a vaccine to go into testing.
Phase 2, yes.
And how long would that take?
The phase 2 will take a few months before we can go into phase 3.
So you're talking within
A year, like I've been telling you.
Yeah.
A year to a year.
Letty is talking about 2 months.
And we would be there in June. We will be there in June.
In a couple of months. I mean, I like the sound of a couple of months better, must be honest.
But when you say June, phase 1 initiation, right? In June?
Yeah.
Not a completed vaccine.
Well, it would be a vaccine that would be ready for testing in phase 1.
But not
Ready to use,
We're talking about a completed
ready to use when, would you say? Ready to use?
on the public. I think it
For
depends.
next season?
So assuming that the vaccine is well tolerated, it's safe and efficacious, as John said, then I think the question is how do we work with the FDA to expedite that as fast as possible through some sort of fast track program to get it through phase 2 and 3 testing to get to
quickly. But the same vaccine could not work. You take a solid flu vaccine, you don't think that would have an impact or much of an impact on corona?
No.
Probably none. Probably not.
So
Wow. Joining us now, infectious disease doctor and a senior scholar at the Johns Hopkins Center for Health Security, Dr. Amesh Adalja. Thank you so much, Dr. Adalja, for coming on the show this morning. It seems the president was having a hard time understanding the timing of when a vaccine might become available and whether or not the flu vaccine could be used for it, which it can't. So what are we looking at in terms of a realistic timeline for a vaccine? And how could that really help people who are already infected today?
So you have to remember that a vaccine is something that's measured really the development time in years. It's not something that we're going to see for at least 12 to 18 months. We're going at record speed getting into clinical trials, but that's not something that's going to impact people that are sick now or this first wave of the outbreak. It's really important work to do, but it's not going to be some kind of rescue miracle thing that's going to happen during this first wave of the outbreak of this virus.
So let's talk about the first wave, which the vaccine will have no impact on. And again, we're talking about a vaccine being available in 12 to 18 months, not a few months, which the president kept thinking that's what he heard. But in terms of the first wave right now, what are we expecting in terms of the numbers rising as testing gets out into localities across the country? And I'll double up and also say, how long is it going to take to get testing truly across the entire country?
we're going to see case counts increase substantially all over the United States as more test kits come online, more state departments of health are able to test. We're going to see a lot more mild cases hopefully diagnosed, which I think is a good thing because we'll understand where the spread of this virus is and understand what community spread means and get communities ready when they see that these cases are popping up all over. And I do think it's going to take some time to get complete testing at all hospitals, at commercial laboratories. That's going to be probably months to get where we really need to be with testing. We need to be able to test for this the way we test for influenza. We need to have this in the hands of clinicians. We need to be able to tell people right away that they have this. And that will, I think, decrease some of the mystery of it. And we're going to find more mild cases, which will bring down that case fatality ratio that people are so worried about in China.
Hey, Dr. Adalja, it's Willie Geist here. We appreciate you bringing your expertise to this conversation this morning. I want to put to you a question we asked Dr. Campbell in our last hour, which is how you're looking at this. I think there is obviously some panic setting in among some people. There are runs on water and food at grocery stores, things like that. Just your clear-eyed view of how Americans should be looking at coronavirus today.
I don't think they should panic. I think they have to be very alert to what's going on in their community. They have to realize that most cases of this are going to be mild. Most people are going to recover. But the fact is, this is going to be very contagious. This is going to be something that every community has to deal with, and it's going to be troublesome for hospitals that work near capacity all the time to be able to deal with an influx of patients, many of whom will be mild, but it's still going to be disruptive to functions at a hospital, and certain municipalities may cancel public events. They may change certain policies around schools. All of that you have to be prepared for. This isn't going to be cataclysmic, but it's going to be disruptive, similar to what happened during 2009 with the H1N1 influenza pandemic.
So, Doctor, accurate information is often a wonderful antidote to panic with regard to something like this. So if you could you go over the easiest and most understood means of trying to avoid contacting the virus right now, the simplest things that are available to ordinary citizens? And the other aspect of it is it true or is it accurate to say that small children, young children, are less likely to contract this than older adults?
Sure. So the first thing is there's really simple measures you can do to decrease your chance of getting this virus. That's wash your hands a lot, touch your face less. If you are somebody that's elderly or has other medical conditions, maybe you want to reconsider large crowds or travel to certain places of the world that have high densities of cases. There's not a vaccine, so it's really just this simple stuff that you do during flu season. Regarding children, it's not that they're not getting infected. It's just that they're not represented as severe cases. Remember, most of our testing is being done almost exclusively on patients that require hospitalization or need to go to the doctor. So these young kids are not getting tested, and we know that young kids can get infected with coronavirus. They just do really well with it and not really need hospital-level care. So it's not that kids don't get it, it's just that they have very mild cases, which is true for many infectious diseases like chickenpox, for example.
And why is that? Why is it that they do very well with it, as you just put it?
There's a couple of hypotheses out there. One is the fact that a child's immune system isn't as robust, and a lot of the symptoms that you get from an infectious disease are when your immune system reacts to whatever the pathogen is that's infecting you. So maybe it's that children have a dampened immune response, so they don't get as severe symptoms. The other is that we know that there are 4 other coronaviruses that cause about 25% of our common colds, and children get many, many more common colds than adults do. So maybe there's some cross immunity because they're getting infected all the time with these other coronaviruses in their daily life, and that might be somewhat protective. It's an important question to answer, though.
Doctor, as a scholar in health security at one of our premier medical institutions in the country, can you explain why the United States did not have adequate test kits available when so many other countries appeared to have those available and ready to use?
It's really been a major shortcoming in our response, the fact that these test kits were not available. And I think there were some missteps that happened at the CDC with pushing this out. There was a flawed test kit. I do think that when they made an emergency declaration, the public health emergency, it actually paradoxically made it a little bit harder for labs, for state health labs, for hospital labs, for some of the commercial labs like the Quest and LabCorp of the world to make their own tests, because they had to go through this emergency use process. Whereas before, where there's not an emergency declaration, you can make your own test and do it at your own facility. And that had to be fixed. And it took a little bit of bureaucratic wrangling to fix that, which is now fixed. And hopefully now we're going to see a proliferation of tests.
Yeah, Doctor, just finally, I know the first case, I believe, in China was December 1. Had the U.S. government started working on this then, would we have tests in place?
I do think if we would have known about this on December 1, but remember, the Chinese didn't really even report this to the World Health Organization for several days after that. So we didn't really know what was going on in China. This virus was spreading surreptitiously, basically from probably sometime in November, even unknown to the Chinese public health authorities. So that virus had a major head start, and now we've been playing catch up for some time.
Dr. Amish Adalja, thank you very much for being on with us this morning.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.